This program contains true stories of rescues.
It's First Aid with Kelly Kincaid.
Welcome to First Aid with Kelly Kincaid. Today we have a special edition of First Aid because it is timely. And, with First Aid, we talk about all various health conditions, but this one really is hitting home for a lot of us. Recently, we had news that Hollywood lost an angel and someone who was spreading the good word, who was a superhero to many. Chadwick Boseman passed away at the age of 43 of colon cancer. And today I wanted to bring in a guest who is a friend to the show, Dr. Lynn O'Connor, to talk about this. She is a colorectal doctor, physician, and is at work and took time out to talk to us about this deadly disease. Good morning, good afternoon, good evening, Dr. O'Connor. How are you doing today?
Good afternoon. I'm doing good. Thank you so much, Kelly, for having me. This is such an important topic, and I'm glad we're discussing, unfortunately, under unfortunate circumstances, but I'm glad we are discussing it.
Yes, and when we talk about colon cancer is like one of the top three cancers of the cause of death now.
Yeah, it is actually the third most common cause of third most common colon cancer in the United States, and it is the second most common cause of cancer death. In 2020, we expect to have anywhere about 140,000 cases and about 50,000 deaths from colon cancer. The problem is 11% of the cases of colon cancer are in those under 50.
And that's what I find so alarming in addition now, because when you think about colon cancer and the colon, going to your doctor, getting your annual exams, it's like when you get to the age of 50, you got to get your colon cancer, or colonoscopy.
Yeah.
And that is changing because now it's being told that you need to get a colonoscopy earlier now.
Yeah.
What's the age? When should people be looking to do colonoscopies now?
Well, initially, colon cancer is traditionally a cancer that was looked at in elder folks. The 68 to 72 years of age is the average age that we were seeing colon cancer. It occurs in all races, all ethnicities, Black men and women, but we found it more disproportionately in African Americans. So when you're looking to get a colonoscopy, the traditional age was 50. Because of the increased incidence in younger patients, we've seen about a 50% increase in colon cancer cases in younger patients since 1994. The American Cancer Society decreased the age from 50 to 45. So now we're asking average risk individuals, average risk being people who don't have any family history of colon cancer, don't have any family history of colon polyps or personal history. They don't have any genetic predispositions, or they don't have inflammatory bowel disease or signs and symptoms to get a screening colonoscopy at age 45.
Wow. I want to ask, what are some symptoms or signs? But one of the things you spoke about is that the age is getting younger now, but also the demographics is really targeted. More African Americans are being diagnosed with colon cancer and getting that. Why do you think that's so?
Well, it's unfortunate. I mean, across almost all cancers, African Americans, men and women, are more predisposed to decreased survival, higher mortality, and our cases are there. I think it's significantly because, either access to care, disparities in healthcare, access to screening. Some of the risk factors are obesity, sedentary lifestyle. We're not getting up, we're not walking, especially now, most of the gyms are closed. Our diet's high in fat, fried fatty foods, nitrates, processed foods like the cold cuts and the bacons. We're just not doing what we need to do, and we're not even exercising. I mean, the American Heart Association recommends at least 30 minutes of exercise, moderate intensity, 5 days a week, and that can actually help stave off colon cancer. But it's those risk factors that really are our problem. And one of the main problems, as I stated earlier, was access to healthcare. The disparities in healthcare and the disparities in access to screening in the African American community really contribute a lot to the incidents that we're seeing.
Dr. Lynn, let's be real though. When we think, and we're talking about colon cancer now because of Chadwick Boseman, right? 43 years old, he was Black Panther.
I know.
He was fit. He looked good. And then towards maybe the end of his life that we didn't know what was going on during his chemotherapy, he had weight loss that you could really see. It was a drastic weight loss. But you're thinking, he was Black. I keep on saying he was Black Panther. He was in all these different movies looking fit and all. And what I've read and been reported that he didn't discover he had colon cancer until stage 3. So what should we be looking for to go get that, in addition to getting to a certain age? What are the signs and symptoms?
You know, it's unfortunate too, because I think it is, he died at 43, and they said 4 years later it was age 39. So, you know, the problem is when you have younger patients, and we do have these signs and symptoms such as weight loss, blood in our stool, change in the bowel habits, whether you have pencil thin stools, you're not going as much, you're constipated, you've got diarrhea, just not something that's not your normal. Those are the signs and symptoms that we look at, but usually those signs and symptoms are advanced. You know, by the time we see those signs and symptoms, our disease is advanced.
Right.
And the problem with African Americans and the younger patients, when they present with advanced disease. And the reason being is because 73% of younger patients present with advanced disease. 82% of younger patients, we're talking early onset, people who are 50 years of young or younger, they're misdiagnosed because nobody is thinking about these symptoms. Nobody's thinking that a 39-year-old with some rectal bleeding has a colon cancer. So it's not registering, let's do a colonoscopy. And the other thing is we're not talking about it with our families. We don't know our family history. We don't know what grandma and grandpa had. We don't know what our cousins, aunts, and uncles had. We don't know if there's cancer in the family. So we're not educating ourselves, and also a lot of our physicians are not educated to look for these issues, discuss it, and in younger patients.
You know, when you talk about the stool, though, I think for me, I do always advocate, I am my first doctor, and you have to know your body. But how do you determine, say you had a bad pick of a Mexican restaurant or a bad burrito, and you have diarrhea for a couple of days because that bug just didn't get out? Like, sometimes I feel like even with the state of COVID and just all these different people dying of different stuff, we're becoming hypochondriacs. You know, so I guess my question is, how do you know if it's a little blood in your stool and you're constipated, maybe because this week you didn't have enough water, that you should be alarmed?
Okay. First, I mean, it's completely understandable, especially in this state of age we are with COVID. And there's so many other symptoms that are associated with COVID that we're finding. But what you want to look for is a sustained change in your bowel habits, a sustained change. So obviously we all have that, you know, Montezuma's Revenge, and we have that Mexican food or White Castle.
Right.
White Castle. It'll run right through you, and that's understandable. But if you notice that you're eating regularly good, healthy food, and you're still having diarrhea, and it's a sustained change, like 2, 3, 4 weeks, this is something that's different. It's your different normal. I mean, everybody doesn't move their bowels every day. But if you notice that you're not moving every 4 days, or it's going to every 5 days, that's when you know something's changed. If you're losing weight and you're not trying to, something's changed. And blood in the stool is not normal, no matter what. I mean, majority of times when patients come to me, 84% of the time when they're having bloody stools, it's usually something from hemorrhoids, a fissure, abscess, but you can't just say that. You have to get it checked. So even if there is something wrong, it doesn't necessarily have to be colon cancer, but get it checked. And that's the thing that's important. Get a screening if you have to. But when you're talking about these signs and these symptoms, we're talking about sustained change. Not just a day, not just a week, not just a binge of eating improperly, or not drinking enough water, or eating beets. Sometimes certain foods like beets, can cause, or certain medications like aspirin can cause you to have a change in your stool, and it
Right.
can look like it's red. Even certain medications. So you just have to check with your doctor if there's any questions. So these are things to make you think. These are things to make you realize this is not normal. This is a change. This may be a sign. This may be a symptom. Let me get checked.
It all seems, and I think that with everything that's going on, it just, as more many people as you hear passing away, and then at young rates, it just becomes so alarming. But looking on the bright side, one thing I want you to speak on how important early detection is, because you can survive. There is survival rates from colon cancer.
Oh, there are a ton of survival rates for colon cancer, which is why we are advocating early screening. This is why we're advocating getting checked.
What I'd like to speak about more is the great thing is early detection is key. Speak about early detection. We've already said when you should, at the age of 45, if you see blood in your stool, go to the doctor. But if you are in stage 1 or 2, what are things that you would advise and advocate for someone in that when they get that diagnosis?
Well, like we talked about, early detection being key. You know, having a colonoscopy when it's and removing it when it's a polyp before it turns into a cancer. And if you do find a cancer and it's an early stage, patients have a 95% 5-year survival if it's removed early. So for those patients who have had symptoms, they went to their doctor, they had a colonoscopy, and now they are positive, and they do have the diagnosis of colon cancer, the most important thing is, one, to keep your spirits up mentally. You need a support group, because this is something that's going to be significant to go through, and trying to fortify your body, mind, and soul. Eating right, that's still very important, because you need that energy to be able to fight. Healthy foods, which have zinc in there, which are immune boosting. You know, you want to have fruits, you want to have vegetables, lots of water. Rest. Rest is key to enable your body to be able to be ready for surgery.
Right.
And really, majority of colorectal cancers, if caught early, they're treated surgically. They're removed. And it's only when you get advanced disease that you start to have chemotherapy. And even if you do need chemotherapy, all that advice applies. Getting the proper rest, getting the proper food, getting the proper nutrition, and having that support group around you so you can make it through the treatment and pass the diagnosis and on to cure.
You said this word while we were talking, hemorrhoids. Is there any link with hemorrhoids and colon cancer?
No, they are not. Hemorrhoids are pains in the bottom, but they come on because of prolonged sitting, standing. A lot of women who are pregnant and have given birth can have hemorrhoids. Even men have hemorrhoids, but there is no link between hemorrhoids and colon cancer.
Yeah.
Hemorrhoids, like I said, you can occur with pregnancy, prolonged sitting, standing, constipation, but hemorrhoids, there is absolutely no link between hemorrhoids and colon cancer or rectal cancer. They are two separate entities.
You know, when we started talking about this, I've always, and I want to say once upon a time, colon cancer was kind of linked more towards men, but women are also, they can get colon cancer too. Why was it? I think it was always pushed over, like breast cancer was women and colon cancer was men. But now, speak about how are the rates with women and colon cancer rising, and why is that?
Well, the one thing, colon cancer is an equal opportunity cancer, and it occurs in all races, all ethnicities, and both genders. So, but for some reason, there is a predisposition for men having it greater than women. So when you look at the races, African Americans stage for stage present at more advanced stage than their Caucasian counterparts. The mortality is higher than their Caucasian counterparts, and the incidence of cancer is higher, and the survival rate is lower. And when you just break it out into African Americans, men for some reason are still in a higher category than women. So it really does happen to both men and women, but men are just slightly higher. And you know what? I may think simply because as women, we're usually the caretakers, the nurturers in the family. You know, we go to see the gynecologist, we take our kids. So we do a little bit more of the health maintenance than men do.
Right.
There was an interesting study that I read that men, regardless of whether they're happily married or unhappily married, as long as they're married, they actually live longer because their wives will take them to the doctor. That's not the same for women, but for
Right.
men, their wives will take them to the doctor. Their significant others that will take them to the doctor.
Female rule the world, you know, we're badasses. Before I close, one of my missions is to get information out. I think it's very important. And I wanted to speak on how can we, I read also that by the time 2030 comes, the rates of colon cancer they're on the rise now, but they're going to get even worse. What can we do, and what could you tell that person who doesn't go to the doctor, who eats cold cuts and just eats bad, you know, bad food and stuff? How can we change this narrative for all ages?
Well, one of the things that's really important is your overall health, because a lot of the problems that we have stem from our lifestyle. Smoking. Clearly, we know that's linked to lung cancer, colon cancer, and several other cancers. Alcohol in moderation, weight loss, obesity, and we've got diabetes, and on top of that, high blood pressure, heart attacks, and strokes, and kidney disease, and that plagues the African American community.
Mm-hmm.
So one of the things is important just from very early on, educating younger kids and parents and the family about eating right, exercising. There's no stigma to get out there and exercising, eating right, you know, leaving the McDonald's, the Taco Bell, and all that stuff alone. You know, every now and then it's fine, but it's moderation. And those are the things that we need to do in the beginning.
Right.
It's that foundation for a healthy lifestyle and healthy eating. Subsequent to that, we need to make sure that we're talking to our family, that we know our family history. We know who had what, when they had it, why they had it, where they had it, and why they had, and what they had. That's important. And then the third thing is making sure we break down these barriers of access to care and these barriers because of disparity. We've got to educate ourselves, educate our families, educate our communities, and sometimes you need to educate your doctor. And if your doctor is not going to listen to you, find another one. If someone is not going to understand your signs, your symptoms, and you demand a colonoscopy and they say, no, you're too young, you find another doctor.
Are there any foods that we could take just to help have a better colon? What's a good colon and what's a bad colon?
Well, I'll tell you right now, bad colons consisting of all that takeout, the fried fatty foods, the nitrates, the cold cuts, the processed meats, all the stuff that's good and fun.
Yeah.
You know, every now and then, moderation is key. Labor Day is coming up. You're going to go to a barbecue. Fine. Have a little bit of something. But if you're having that every single day, if your meal consists of McDonald's for breakfast, Burger King for dinner, and Taco Bell for lunch, that's not what you need.
Right.
The foods you need are the ones that are going to nourish your mind and your body. And we're talking about high fiber fruit and vegetables, such as whole grains, nuts, vegetables, green kale, leafy green kale, spinach, broccoli, fruit, grains, lots of water, and everything else in moderation. If you're a woman, you really should only have one drink a day. A man really should only have 2 glasses of wine a day. So, you know, if you are going to drink, and absolutely no smoking. So the foods you want are the foods that are going to be healthy and that's going to be able to increase the fiber. You should shoot for anywhere from about 20 to 35 grams of fiber a day. Slowly but surely build up to it, but that's what you're looking for. And enough fluid in the diet to move that stool through.
Right. When you say fiber, people who are maybe don't know off the bat, what does that mean? What type of fiber? Like what?
For instance, let's just say if you are gonna have a bagel, instead of getting that poppy seed white plain bagel, substitute it for a whole wheat bagel.
Mm-hmm.
If you're gonna go and have a sandwich, a turkey sandwich, get the bread that's whole grain, multi-grain, 12 grain. That's what you're gonna look for. If you're gonna have a salad, instead of getting the romaine or that iceberg, put some arugula, put some kale, put some spinach. The darker your greens are, the better.
Right.
You want to do a quick way to understand whether or not you're eating properly is eat the rainbow. Your whole plate should not look one color. For instance, when you go to Kentucky Fried Chicken, you get that biscuit that looks pale brown. You
Right.
get the mashed potatoes that look pale white, and then
Right.
you get that thing that's supposed to be chicken that looks brown as well. The whole plate looks the same color.
Right.
So you need some oranges, some with some sweet potatoes without all the sugar. You need some kale. You know, you need some spinach on there, and then you can have a protein like a fish, salmon, eggs, and you see the different colors on the plate, and that's what you're looking for. That's what you want.
And that's simple. I think sometimes we complicate it because it tastes so good, but there's so many things in the rainbow that taste good that keeps you healthy because we're already battling COVID. You
We
know.
are. We are. And you know what? You can have good food.
Yeah.
You don't have to fry it. You can boil it. You can steam it. You know, there you can and add instead of the salt, there's other spices. So there's little ways to do that. And for moms who are cooking for kids, you can stick spinach in something and those kids will never know. Make a smoothie, put some spinach in. Make an egg, put some spinach in, a little bit of tomatoes, a little bit of onions. Just stick those things in there and you'll be able to slowly but surely change the diet. If you want to eat Cheerios, have Cheerios, but throw some Fiber One on there. So you just mix it up so you're able to get a little bit of good food, you know, a lot of good food with a little bit of fun food. And that way it doesn't seem like you're eating cardboard and rabbit food every day.
That's so cool. Well, I want to thank you, Dr. Lynn O'Connor, for taking time out to continue educating us because, you know, the last time you were on Sway in the Morning, it was so educational, it was fun, it was engaging, and, you know, these are important topics because I want people to live. That's why I do this, and I know you continue to put endless hours in to educate and help people live a healthier lifestyle. If anyone wants to reach out to you, have any more other questions, how can they reach you?
They can reach me. I'm Chief of Colorectal Surgery at Mercy Medical Center and Rockville Center, as well as the St. John's Hospital in Bethpage. My phone number for my office is 631-350-6277. That's 631-350-6277. And you can go onto my website. There's a lot of information. There's a lot of ways to reach me, and it's really Colon and Rectal Surgery of New York, just like that, all spelled out. Colon and Rectal Surgery of New York, and you'll be able to find me.
Thank you so much, Dr. Lynn O'Connor.
Another thing I want to let patients know, if they're not really on the website, you can also find me on social media such as LinkedIn, Facebook, Twitter, YouTube, and Instagram. So reach out, you'll be able to find me. It's Dr. Lynn O'Connor, MD.
Thank you so much, Dr. Lynn O'Connor. Until the next time, be well, be safe.
Thank you.
Okay, thank you. I'm Kelly Kincaid. This is First Aid with Kelly Kincaid. Until next time.